the anterior talofibular ligament, the posterior talofibular ligament, and the calcaneal fibular ligament. We're going to focus on these three ligaments because they are the most often injured, but the treatments we go over for ankle sprains can be applied to any ligament at the ankle, medial or lateral ankle. So these ligaments connect bone to bone. They help provide stability and they prevent excessive mobility from occurring at the ankle. These ligaments are the most injured ligaments of the ankle. The anterior talofibular ligament originates from the front of the lateral malleolus of the fibula and attaches to the front of the talus. The job of the anterior talofibular ligament is to resist inversion and plantar flexion and help prevent the talus from coming forward. It is the most frequently injured ligament of the ankle. The most common mechanism of injury to the ankle ligament is an inversion of the foot. You hear people joke sometimes about breaking ankles during basketball, meaning the body went one way and the ankle went the other way, and that's usually an inversion sprain of the foot or the ankle. The posterior talofibular ligament also provides lateral stability to the ankle and originates at the fossa of the lateral malleolus and attaches to the posterior surface of the talus. The calcaneal fibular ligament is narrow, rounded, and connects the calcaneus to the lateral malleolus. Clients with ankle sprains will present with ankle pain that is often worse with weight bearing or with inversion movements. Swelling, bruising, limited motion, and sometimes maybe even a popping sound may occur. Pain in the ankle will affect the way a client stands and walks, and because of these compensations can lead to knee pain, hip pain, and even back pain over time. The ankle and its ligaments are relatively small in comparison to other parts of the body. Not only that, this is a very bony region and cups have a hard time sticking here, especially when attempting to move them dynamically. So instead of moving them dynamically, we're going to apply our cups statically and have our client move dynamically. This will allow the adhesions of the soft tissue and ligament fibers to pass underneath and be reduced by the cup. Have the client stay within their pain-free range and perform dorsiflexion, plantar flexion, eversion, and inversion of the ankle. This will help reduce stiffness and pain and restore normal biomechanics and proprioception to the ankle during rehab. To treat the pain and stiffness from an ankle sprain, we are going to use the Chakra cups or the Energy cups by Lure Essentials. The Chakra cup is similar to the Energy cup, but you can apply these two different ways like we talked about before. You can flip them inside out and back again. I'll show you that on our patient, on our client. Flip them inside out. Place that dome over the ankle. Press the edges out so that the cup flips back outside in. Or if you think the ankle is maybe a little bit too angry for that type of application method and you want something a little bit softer, you can now just take the base of that Chakra cup, put it over the ankle, and then press down on the top of that dome. And that's a lot less aggressive and more gentle to that ankle. From here, if we wanted to introduce any movement, we can have her go through dorsiflexion and plantar flexion. We can have her do circles. We can kind of guide her into dorsiflexion and back into plantar flexion. If we wanted to do small circles with the ankle, we can kind of guide her and tell her to stay within her pain-free range. We can go in a clockwise motion, and then we can reverse that direction and go in counterclockwise motion.